Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and here's my roundup of the week of the top 5 things in dentistry relating to the COVID pandemic. So the big news of the week, which I'm sure you haven't missed, was delivered last night, declaring that the green light had been given for dental practices in England to reopen and to offer face-to-face patient care from the 8th of June. Unlike the expected phased approach of the devolved nations, government in England has opted to go straight in with what is essentially a back to work date, placing the responsibility onto practices to decide if they are adequately prepared to open their doors again. NHS England and CDO Sarah Hurley sent a letter to practices yesterday with the announcement, and it was made around the same time on the BBC, reiterating the message that practices can reopen providing they have the necessary infection prevention control and PPE available. A lot of frustration was expressed last night and this morning across social media and directly with us about the way the news was broken to the public without forewarning to the profession. And we understand, share your frustrations about that, and we've made it clear to NHS England there's now a big job to be done in managing patient expectations over the coming days. And in that regard, we've added our own patient letter and poster to our website this afternoon, and the links are available on the live feed. Many people felt that the announcement put practices at a disadvantage in terms of their preparations and decisions about delivering pet care. We know, following further discussions with NHS England today, that there will be further updates next week, setting out in more detail the return to work and face-to-face care. So look out for that early next week. In terms of the news itself, we know this is what many practices have been calling for some weeks now, so many of you will be pleased and feel able to start to expand the care on offer to patients. However, we also know that not every practice will be able to open in the same way and at the same time, and the pace at which patient care can begin will be determined by a number of issues, such as stock levels of PPE, and also the ability to fit test the higher end PPE may limit the range of dental care that can be offered in the coming weeks. We believe that one way to help dentistry in terms of supplies of personal protective equipment would be to integrate it into the wider government strategy on PPE. We also know that PPE, whilst key, is not the only issue to consider before practices are able to return to work. To help you get up and running, we're creating a new toolkit which contains practical guidance, templates, training, PPE and fit testing, and a lot more. It's going to be a really comprehensive, practical way to help the profession return to normal clinical work, and we'll have it available to members in the early part of next week, so I hope you'll find it useful. And thank you to the thousands of you who've completed our survey over the last week, asking for your views about return to practice and attitudes to things like the use of PPE. And those responses have been really useful in shaping our thinking, and we'll share the results of that survey with you next week. So whilst we move into the next phase for dentistry in England, we still have unanswered questions about the current interim NHS framework. We're still waiting for clarity on the abatement to be applied to NHS contracts, and we've made the point that this has taken so long to sort out now that it would really not be fair to expect any abatement to be claimed back by the NHS over a short period of time. We're also waiting on the precise nature of the sanctions for contract holders who refuse to pass on payments to associates during this current time. We've got several hundred contract resolution queries from associates on hold, waiting for an answer on that issue. So we're continuing discussions on these issues with NHS England, and we know that many other questions will emerge as face-to-face care increases, and we'll continue to seek answers on your behalf. The devolved nations continue to press ahead with their phased roadmaps for the restoration of face-to-face care. In Scotland, discussions have been taking place this week around the interim contractual arrangements, and we also saw the publication of new guidance by the Scottish Dental Clinical Effectiveness Programme, or SDCEP, on returning to practice. We understand that the Scottish CDO, Tom Ferris, is going to make a further announcement in the near future about a reopening schedule. In Northern Ireland, the GDS Re-establishment Group met again today to consider draft operational guidance to support practices preparing to return to work. The Northern Ireland DPC Chair and Northern Ireland Director for the BDA met with the acting CDO, Michael Donaldson, today to discuss issues relating to the next phase in Northern Ireland. And in Wales, discussions continue around the radical approach to NHS contractual payments announced last week by CDO Colette Bridgman. Of course, we'll keep you up to date with developments in the devolved nations as they unfold. So that's all from me this week. As ever, things are progressing and changing at a rapid rate, and there are always some unknowns, but we'll continue to do our best to get firm answers where we can and guidance for you. And to that end, I'll be back with more news next week. Have a safe and healthy weekend.